I wanted to talk today especially about the notion of the scientific research, which is not defined neither in GDPR nor in any other legal act that can be binding for all the people who are discussing about the subject of scientific research and health in Europe. And when we look at the scientific research, we usually look either to activity or to the governance of the research. So to the activity, I can say that the GDPR is trying to convince us that we can quite broadly define scientific research, and talking about it also at the time when we are observing some phenomena, when we are trying to find some hypothesis on that, or when we are qualifying this hypothesis and validity of this. But it also means that we can use the example of technological developments and demonstrations of them and the fundamental research as the part of the scientific research. But it does not mean that the notion of scientific research does not have the boundaries. And that is the first thing which we are lacking, because the actors which are taking part in the scientific researches may recognize it very differently and may talk about it very differently. The European Data Protection Supervisor tried to approach this in its preliminary opinion on scientific research in 2019. But I have to admit that there was not too much follow-up of that last years, and we are going to come back to that in 2020, in 2024 and 25. And that was partly because we waited for the codes of conduct from the scientific research community. But at the same time, we realized that we will not get one for all. And the answers may differ by the sector. So at the same time, we remember that when we were talking about GDPR, we heard this cry, do not overregulate. We know our business model better. We know what we do better than you. So just give us principles. And when we passed GDPR, we hear the other cry. Where are the templates? Where are the guidelines? Where are the checklists? And the answer is, there will be no checklists. There will be very few guidelines. Rather not templates, but we have to cooperate with each other. So let me use it as a kind of start for the discussion about scientific research, both from the GDPR perspective, but also perspective of European health data spaces, which seem to show that the best example of the secondary use of the data is the use of data for scientific research. The national level codes which are proven and the European one which are not. 2 points about this. First of all, I think that most of the problems are not in the personal data protection law, in GDPR part, but rather in the professional confidentiality rules and the medical law which exist on the national level. That proved to be the problem to harmonize it all over Europe, and that's why the national solutions are quite successful, while the European are not. And first of all, this is not the first time that try for the code is starting with FPR. As far as I know, this is the third attempt. Okay, I was taking part in the works which were in 2014 about the same kind of code and were not successful either. And the reason was exactly the same. So the reason was to make all European solution at this time, also with data protection law. Here we have the GDPR, which is the same. The problem of interpretation, that's true. But first of all, the additional law on medical research or medical trials or clinical trials, which is on the national level.